Hello everyone. Today we have with us Dr. Anil Srivastava, who is the president of Open Health System Laboratories, which was created as a program of International Network for Cancer Treatment and Research in 2008. The OHSL is now involved with Indo-US Cancer Knowledge Alliance. Thank you so much, Dr. Anil Srivastava, for joining us. So, can you please tell us more about the International Network for Cancer Treatment and Research?
Yeah, this is an organization which was created more than 15 years back, and it worked with cancer research and treatment centers all over the world, basically in developing world, and did a lot of work with people in India. And our focus was how do we sort of build capacity of medical people in these countries to get access to the best of research and be able to take it to the bedside. So that's really what we're working on.
So, can you please tell us about any cost-effective methods for evaluating public health interventions to incorporate disease prevention and health promotion?
See, eventually, the question of cost-effective, as this conference has been discussing, is going to be a balance between quality and there is a point where you cannot allow cost to be the decision making on the quality. Because the quality that you need, or quality of care you need, is not dependent on the affordability on the patient side. I mean, every patient needs the same quality. So I think it's possible to be able to share experience and things to do that. And this conference is a very good example that a lot of people here are learning how can it be done for a better price and a better quality. So it's a matter of exchanging experience and being able to compare notes and work together globally. That's the way I believe.
So, how to bridge the gap between government investments and the implementation by the institutions?
I think one is definitely efficacy and efficiency. Definitely the question is health a right or health is a commodity? If it's a right, then there is a need for government investment. As the last speaker just now said, we have neglected the public sector investment in, so we need to be able to bring it back. And that's the way to go about it. The gap is there, but the gap is something which can be filled up. And it's not something that can be. We cannot follow the American model where the healthcare is the highest cost, lower quality. I mean, and there we are arguing whether people need healthcare, but there are 40 million Americans who would need it now, who will be out of healthcare system, the richest country in the world.
So, what are your views on the digitization of healthcare, and do you think an online professional community of doctors can help in generating awareness amongst doctors?
Yes, the answer is yes. I think the technology has come to a point where knowledge is something not only shareable but is also co-developable, if I can twist that word. So, for example, the cognitive computing, and just take that example. Everybody must have heard of IBM Watson, for example. Or take the fact of the cloud computing, the fact that you can access it from anywhere you're working with, allows us to be able to share knowledge and develop knowledge further and apply to the patient's care. So that's very much possible. You just mentioned before that about summarizing the papers.
Yes.
Now, if you really use something, a cognitive tool like Watson or others, they're able to do that summary. So now you're talking of millions of papers, and we're not talking of things. The human effort has a limit to it. So the question is, there could be a machine and man come in tandem working. The machine does the drudgery, and the human adds quality to that. So I think there's to be a combination of it, but there's no denying that there's a need for knowledge to be available to the patient, to the doctor, and for the doctor to be a better doctor. I mean, I understand.
Thank you so much, Dr. Anil, for your kind words. To stay updated on our latest scale videos and interviews, please follow us on Twitter, like us on our Facebook page, and subscribe to our YouTube channel. Happy Docplexing!